What will be the impact of this package? And I'm referring to on USAID as well as NPR and public radio, public television.
A rescission is a fancy word for repealing a former spending bill. And those former spending bills were bipartisan. So you have a deal worked out between Democrats and Republicans representing a whole host of different issues in their home states. And then it's being undone in a partisan fashion with the president saying this is a loyalty test. This is how a republic descends into a strongman state where votes are framed as loyalty tests rather than Congress seeing its role under the Constitution. It is to design the policy and the president's to enact that policy. So this partisan strategy on the power of the purse is hugely threat to our core vision of government by and for the people. So the first rescission, that is the first repeal, which was AID, not only is it bad on constitutional grounds, but it is absolutely horrific. It basically puts a blessing on what was done earlier this year by the Secretary of State, Marco Rubio, and by Elon Musk, where they shut down USAID programs on nutrition, malaria, tuberculosis, and AIDS overnight. And those who work on health issues, the experts say already over 100,000 children have died from this sudden shutdown. This is an egregious, horrific mark on the United States of America. It also does enormous damage to our soft power. Rather than being a country that's there to assist other countries in taking on significant challenges in healthcare, we are now the country that, with no warning and no plan, shut things down overnight and caused hundreds of thousands of deaths.
And switching gears, we have a lot of fires happening right now, wildfires, a couple of big ones, including the Cram Fire. The governor issued a state of emergency last week for these wildfires, but in March, there was a state of emergency issued for those floods. And I spoke with Douglas County officials about the FEMA funding maybe a couple of weeks ago, and they said they had not received funding. Emergency management told me they had not gotten confirmation from the federal government of whether or not they were going to get funding. How do FEMA funds work? How do we know when we're going to get them?
Well, so the first step in the process is the state essentially compiles the damages, and the damages have to exceed a certain level before they forward it to the federal government. And then FEMA basically fact checks that. And then we push like crazy to get a declaration from the federal government that releases the FEMA's ability to respond. And, when we're talking about this and we're talking about the Federal Emergency Management Agency, FEMA, but let's just pause for a minute and recognize the human damage of these tragedies, of the fires in Oregon, of the floods in Texas. And the president has proposed dismantling FEMA. And my response is, hell no. These issues, these tragedies that occur, are too big for local communities or even states to handle on their own. We need experts who travel the country, bringing the best, fastest response to assist families in distress.
Do you have any insight on when those flood victims in that community, those southeastern or southwestern Oregon communities, will maybe see some help?
No, we don't have an answer from the Trump administration yet, but I'm seeking answers, and I'll be conveying that to our local officials and can be continuing to advocate for those families affected by tragedy back home.
Federal funds were released by the Trump administration for local school districts, and funds are coming in, but for those DEI programs, there's still a block. First and foremost, what is DEI?
Sorry, Gold, what is it? I missed the last word there.
I was saying, what is DEI?
Oh, what is DEI? Diversity, equity, inclusion is what DEI is. And it's a recognition of that we are immigrants from all over, as well as tribal members here in America. We come from many different viewpoints. We bring many different traditions, and that's the American melting pot. But we can find strength and value in those differences that we bring to the table. That's the diversity. Equity is treating people fairly. That's an American value, and that nobody should be discriminated against. That's inclusion. And so that those are our core values. But the administration has tried to reframe them as something entirely different, somehow a menace to have fairness, or a menace to oppose um, discrimination. No, no, we should all oppose discrimination. We should all support equality of opportunity.
And I mentioned that the funds were released for the school districts, but those having DEI programs are not getting funding for those programs. What should these local school districts do? Should they go based off of federal mandates, or should they go off of state law?
Well, recognize that what the Trump administration doing is violating the Constitution. The executive is not allowed to say we are going to set the spending levels for programs by impounding funds. It's been to the Supreme Court twice. In fact, Congress tried to delegate to the Supreme Court a line item veto, and this, or delegate to the president a line item veto. And the Supreme Court said, no, no, the Constitution says you, Congress, are responsible for that. And just recently, the head of OMB, the Office of Management and Budget, said, well, we're just going to treat the numbers in the law as a ceiling. And no, no, if Congress wants it to be a ceiling, the law will say you can spend up to a certain amount. When we say you must spend this amount, then that's the law. And so we're going to be doing this battle over this, because essentially what the president's trying to do is move the power of the purse from Congress, where the Constitution assigns it, and into the executive branch. The challenge here is that the courts take a long time to react. So it's very troublesome. In fact, they've been it's not just these programs that we're talking about, diversity, equity, inclusion programs. It is also, for example, Head Start. Head Start, are you kidding me? Impounding funds, freezing funds for our vulnerable children trying to get a decent start in life? No, Congress has said spend these funds. The president needs to release those funds immediately.
With Planned Parenthood seeing cuts now, any that have received $800,000 or more from Medicaid for abortion, should Oregon reconsider its pro-abortion law, seeing that Planned Parenthood here offers abortion and will lose that Medicaid funding?
So what was in the big ugly betrayal of a bill was that Medicaid, which in Oregon is the Oregon Health Plan, cannot be used for anything provided by Planned Parenthood. And by anything, I mean the majority of the work they do in healthcare is not abortion. It's all kinds of other breast exams, helping people catch cancer, prevent cancer, all sorts of other health care. And that's outrageous. To tell Americans they can't take their insurance policy to get basic health care where they have the best relationship, where they have the need. But it is a reality. It is an impact. It's extremely unfortunate. It's absolutely what was wrong with this bill. But let's not forget that this bill also is devastating to rural health care. Oregon Health Plan has a much higher subscription rate in the rural areas of our state. And what that means is that there'll be far less revenue as people, it's an estimated 150 to 200,000 Oregonians over the next several years, because the bill is implemented over several years, will lose their Oregon Health Plan. And that means the revenues to rural clinics and rural hospitals will drop, which means many of them may well go out of business. That doesn't just affect people in the Oregon Health Plan. It affects everybody in a community, no matter what their source of insurance is, when the clinic or the hospital shuts down.
But there was 50 billion set aside for those rural hospitals in that bill?
That $50 billion is a slush fund. It came out of Senator Collins of Maine trying to find some political cover for the impact of this bill on her state because she is up for election. That doesn't begin to replace the revenue that flows through Medicaid throughout the country. There's no guarantee any of that funding would come to Oregon.
Do
We
you
just
have,
have time for one quick question, and then he's got to go vote.
gotcha. Last question. Do you have concerns that rural hospitals in Oregon may see closures?
Absolutely. I mean, we've already seen the stress that they're under. We lost the maternal unit in Baker, Oregon, Baker City. Senator Wyden and I fought to keep it open. We were really frustrated that the hospital announced it. It's shut down without kind of announcing the risk and trying to see if we could rally support to keep it open. The idea that you're about to deliver a baby and you've got to go 70 miles down a freeway in the middle of winter when maybe the freeway is closed and you may not even make it to a hospital. It's horrific for that to happen. But that's just an example that you take away the funding from Oregon Health Plan that pays. I mean, we have a very high sign up rate in Oregon. I mean, we're well over, I think, 95% of people have health insurance. That will change significantly with this bill. But again, not only affecting the families that will delay health care or split pills and get sicker, or their cancer will get greater before it's treated, or their health be compromised, but it will affect everybody in a community when the local clinic shuts down or the local hospital reduces services.